Good evening from Rocky Mountain PBS. I'm Cynthia Hessin. This is Colorado State of Mind. Tonight, new developments on the Affordable Care Act, Obamacare, as the president has claimed it. Here in Colorado, a brand new marketplace is about to open in 2014 with consumers and insurance providers electronically connected for an open, competitive process of choosing the best health care coverage and cost. Here to talk about it tonight, Steve ErkenBrack of Grand Junction, one-time district attorney in Mesa County, head of the insurance provider Rocky Mountain Health Plans, and member of the board of the new Colorado Health Insurance Exchange. We've practically got the whole story right here with Steve. Next to him, Elisabeth Arenales of the Colorado Center on Law and Policy, a watchdog on how the exchange is going to work for those who buy insurance there. Michael Booth and Katie McCrimmon are medical and health reporters for the Denver Post and Health Policy Solutions, respectively, so they have been closely following developments ever since Obamacare was just a loud clamor in 2009, leading to its passage by Congress. And in the time intervening, many of us have lost touch with exactly what's happening with the rollout. Few of the health reforms and predicted impact of the Affordable Care Act have really been prominent, or have they? The Kaiser Family Foundation released results of an interesting nonpartisan study last month showing that 4 in 10 Americans questioned were unaware that anything was about to change with health care. Another 12% thought Obamacare had been repealed once they sent their Republican representatives to Congress. It was not. Rumors of its demise have been greatly exaggerated. But it does look like a good time to get up to speed again as 2014 looms in the distance, especially about this health exchange Colorado is about to debut. So, Steve ErkenBrack, you have been in the middle of all this health care reform effort for a long time. You're a Republican. This marketplace approach was a Republican idea, at least at the very beginning. Remind us how crucial it is in how it works and how it fits with the overarching goals.
So it's a terrific question, and I'll try not to take the entire rest of the show in order to answer it. The bottom line is this. Keep in mind that this discussion's been going on long before President Obama took office, and long before Hillary Clinton started to address healthcare back in the 1990s. This has been a discussion that's been going on for many, many decades about how do we control the cost of healthcare. And that part is bipartisan. Nobody wants to see these 5, 10, 15, 20, 25% increases in their insurance premiums.
There's a problem right there in front of us.
Right there. And so how do you find a way to deal with that? The exchange in Colorado really started not with the federal law, but started with, as you referenced, the Healthcare Reform Commission. That was a bipartisan effort. It was created when Governor Owens was in office, and the Democrats controlled the legislature. Half of the people were appointed by Democrats, including Elisabeth Arenales. Half of the people were appointed by Republicans, including me. And we sat there and worked through this, and at that point you realize you have to find a way for consumers to be able to understandably, knowledgeably, and affordably price insurance products. That's the creation of the exchange. When the federal law was enacted that allowed Colorado to then take its model and work in sync with the federal government, that's what the state of Colorado sought to do, and did, again on a bipartisan framework with a Democratic Senate sponsor and a Republican House sponsor, creating this dynamic that would create a unique exchange. And that's something I hope we get to talk about today, that the conversation is frequently there's an exchange, it's part of Obamacare, when in fact what you are seeing throughout the United States are states taking charge of their destiny and using an exchange to do everything from evolve to a single payer model, which is what Vermont's doing, to create a marketplace to attract as many health plans as possible so that consumers have as much choice as possible, and you let the market work to improve quality, improve value, and lower cost.
All right, so that is a lot that it's asked to do, and we will come back to how things are different in Colorado than they may be elsewhere. Michael and Katie have been keeping an eye on a big piece of this, which is the technology that will make it work so that Coloradans have this access to such information. How is that rolling out, Michael?
They've had a few glitches. They have a lot of challenges. This week we had some glitches with the state part, the Division of Insurance part of some information that needed to come out to give people an idea, a way to access what the base rates are going to be, sort of the retail price that they might see as the sticker price on their health insurance plan. The state was going to put all that in one place. The site that they tried to roll that out with didn't work for most of the day this week that it first launched. And even when you do get there, you're asking average citizens to look at 100-page rate filings and try to understand where exactly the price is and what that means for them and their family. So that's a difficult thing. Many challenges ahead, which Katie can talk about in terms of what the exchange part of it, which is separate from the State Division of Insurance, has in front of them. But I think we need to step back and remind people why the exchange is one of the key parts of the Obamacare plan. There were two things that Obamacare was going to bring to expand health insurance to many people who are tens of millions of people in America who are still uninsured. One was an expansion of Medicaid to many more people. There have been both state of Colorado efforts and federal efforts to make that happen, and that will be happening now. But the exchange is where people can go who are still uninsured, who don't qualify for Medicaid. It's the only place they can go to get the federal subsidy on their taxes that will help them pay for that insurance. And that's the piece that I think that people need to understand first when they are asking, well, why do I need to know about this? Well, if you are uninsured, or if you have a small group plan that is too expensive for you, or your employer doesn't want to, if you work for a place that has 50 or fewer employees, your employer doesn't want to provide that anymore or never has, the exchange is where you're going to go to try to find a plan that you can afford. And then when you hit the send button, you are supposed to get an idea of what the federal subsidy will be that will tell you what part is left for you to pay and whether you can afford it or not.
That sounds like everything you'd need to know. Is it like one of those things where you fill in information on the web page?
Yeah, the whole idea of this is that it will be a little bit like TurboTax, you know, where you'll, at first they said Travelocity, where you'd just, and then you'd have your flight or your insurance plan, but it turns out it's not quite that simple. And so now the idea is that you come to scripts and you answer questions along the way. But this is a Herculean task, and we're going to struggle to get to go live, which is October 1st. That's the date that all of this is supposed to start working, and then the plans will go into effect on January 1st. And we've been reporting on problems behind the scenes with the technology, and it's not surprising because this is remarkable what we're trying to do. The computer system here has to communicate with the federal system, and this is all supposed to happen in real time, where you head to the federal hub, it's called, get your tax information on the spot, get your immigration status on the spot. You've got to make sure you're legal and find out your income, get your verification, and then also communicate with the state system, which, as you know, we've had problems here for years.
A lot of old computers in the state system.
Yeah, these legacy systems, they call them. And this is all supposed to happen seamlessly and in real time. So it's certainly a challenge.
Talk more about that, Elisabeth. You must be concerned about whether it's going to be ready by October 1st?
Well, but from the consumer perspective, I mean, the important thing is the date. October 1st is the date that people are going to be able to begin signing up for health insurance coverage, and that's really an extraordinary thing. For the first time, people who haven't had insurance or access to insurance are going to have the opportunity to sign up for coverage. And so I think focusing on the fact that opportunity is live starting October 1st. It's going to run from October 1st through March 31st of next year. That's the first open enrollment period. And that for people who are uninsured, we have different people have different numbers, but we'll use 750,000 people uninsured in the state of Colorado. Hundreds of thousands of them are going to be able to come in through the exchange and to the Medicaid program, as Michael just said. So there may be glitches along the way. It is an enormous undertaking. There's no question about that, and I hope we're all patient if there are glitches. But the excitement about this opportunity and the hope that it brings to the state to finally give opportunities not just for people who are uninsured, but also for people who are insured today. People who are in small businesses who, if their businesses choose, are going to have the option to choose a different plan maybe than their fellow employee so that they can shop and choose the plan that's best for them. There'll be filters. The technology will allow for filters on the exchange so you can shop for the things that are important to you and your family. And there'll be a way to calculate the subsidies that you're eligible for and your out-of-pocket costs so that you can see what your expenses are going to be, which is going to be really important for families.
That sounds almost magical, and I'm sure, take us inside the boardroom. These were all things that you all wanted to have part of the program, I'm sure. A lot of decision-making there in terms of which software you're going to use or how it gets put together with this old state system?
Well, as everybody has indicated, one of the challenges of this, and there are many challenges, but one of them is the time frame that we're operating under. You know, when Rocky Mountain Health Plans decides to move to a different IT platform, we get to do it on our time frame. We get to choose the plan we want. We get to sort of adjust as you go along. But because this is a law, we don't have that luxury in Colorado. We're going live on October 1st because the law says this goes live for January 1st, 2014. And we then have had to, at the exchange, as we build this unique Colorado model, find a way to delegate out the number of tasks that we have. So one of the things that we did, the board that was established by state statute, by that bipartisan piece of legislation I talked about, has 12 people on it. What we did is to basically divide responsibility. So we have an IT committee, we have a finance committee, we have an executive committee, and we have a rules and regulations committee, the committee that I chair, so that you can delegate out, because we are doing many, many things simultaneously. And as Katie indicated, has it all gone perfectly? Of course not. We're human beings in a human experience operating under this long time frame, and you're always, I don't think anybody would have predicted, hey, we're just going to do this effortlessly, any more than anybody would have predicted that the Colorado Rockies would win every one of their baseball games, right? That's not the point.
You should go for that kind of start, though, right?
Well, and that's the start we are going for. But even on that, I'll follow this analogy if you want. Even on that, you can't focus just on the top of the third inning in the 18th game of the season. This is, as Elisabeth pointed out, a long-term and very fundamental change. One of the reasons it's so critical to make sure the IT links that are there are in fact there is that we have had in America this siloed delivery system. So a person is in healthcare because they work for this employer. And if they move to a different employer, they're in a totally different healthcare system. Or because they're in Medicaid, or because they retire and they're in Medicare. And you have all of these silos.
Or they're a veteran on the VA.
Or they're a veteran, or they're an active military. And what we are trying to do here is to break down those silos, or at least build bridges between them, because people won't stay conveniently in one silo or another. They may be with this employer in year one and a different employer in year three, and uninsured and unemployed in year two. And their health care, to the extent that we can address this, shouldn't be impacted by that. How do we build a healthcare system that looks at the community of Colorado and not at where you happen to be getting the bill paid?
So I was going to ask Elisabeth whether you're, as someone who's been to a lot of the meetings and watched this for some time and will continue to be, do you get a sense yet of what the consumer experience will be? Let's continue the baseball analogy. Opening day, October 1st. Do we have a sense yet of what's going to happen in Colorado and what it will look like? Talk a little bit about the navigators and what their role might be and what they're intended to be.
I mean, I think we have a sense, as Steve said, that things are moving very quickly and that it's an enormous undertaking, but a lot of hope for what things are going to look like October 1st, because we know how much energy and expertise has gone into this. There are different mechanisms that are being created to help consumers. One is still outstanding, frankly, is the application itself. The federal government listened to a lot of feedback from the community when their very cumbersome application came out and streamlined that considerably, and we hope Colorado will follow that model because it'll make it a lot easier for people to get into coverage. And
is it modeled on something else, like, Social Security or whatever? I mean, did they invent a new wheel here?
It's a pretty new model because they did pare down the original version and make it very simple, 3-page application for what is ultimately a fairly complicated process. So, and then, as Michael said, there's mechanisms that the exchange is designing that are designed to really help the customer or the consumer come into coverage. So, the exchange is developing a very large, helpful, I think, ultimately customer service center that people will be able to use by phone. They're developing a network of health coverage guides across the state so that people can have in-person, person-to-person assistance as they're filling out applications or asking questions about how all of this works. And so I think the package that's coming together is a very good package. And of course, like anything else, we'll see how it plays out. But again, I think there's going to need to be, just like any large rollout, sort of regrouping, and are we doing things as well as we possibly can, and do we have the tools that we need to make things work, and are we listening to people and hearing what their experience is so we can improve if we need to.
All right, so the ones who start signing up October 1st are going to be the help for the ones who come in after January 1st.
We hope so, and we know, that what's great about that is that coverage doesn't actually begin until January 1st. So we can start signing up on October 1st, and then if there are difficulties, hopefully work those out by January 1st. It gives us some time.
But it's going to be fascinating to watch. If we build this, will they come? There have been lots of conversations about that. And just this week in California, some of the big health insurance companies are bowing out of that exchange for the first year. Here in Colorado, we're lucky because we have 17 companies and 800 and some plans that will be offered on the exchange. So it appears that people will come, but we also have the possibility that the sickest people will sign up, which could really throw a curveball to companies like yours, couldn't it?
Exactly, Katie. That's the challenge, and that's why it's important to keep the baseball metaphor in line. We're talking about the whole season here, right? And whether at the end of the day, the Colorado Rockies are going to hoist the World Series championship trophy, which we all hope for, and whether at the end of the day,
for Coors Field.
There you go. Whether we will have built a model here that works. But let me make a note of the relevance of this, because I can imagine there's somebody sitting in the audience who's saying, yeah, okay, that's fine, but you know what? I have insurance right now, and I'm doing just fine, and my employer has told me that he's going to keep giving me this, my product, and so why should I care? And the reason you ought to care goes back to one of the things that Michael said about the subsidies that are available. The subsidies that are available for here that we typically define in the statutory terms by up to 4 times the federal poverty level, and people say, well, okay, that's fine, it's federal poverty level, I don't need to worry about that. That is, for a family of 4, an annual income of $90,000. That is a huge pool of people here. The other reason that people ought to be looking at the exchange and why it's relevant to them is something that we learned in the 208 Commission. One of the first questions that we posed way back when, in 2007, to our economic modelers was, tell us the impact of the cost shift that we all deal with because of the uninsured. And they actually expanded the question to the cost shift from the uninsured and the government lines of business not paying for as much as Elisabeth would like to see them pay for example. And what they determined was, if you fixed those 3 things, just magically eliminated the uninsured, had the government lines of business paying full freight, your healthcare costs would go down 30%, period, immediately.
How soon will that happen?
Well, as soon as we get everybody covered, and that's going to be a while. But that's the importance of this long-term perspective. How do we get more people covered? Because the more people you get covered to reduce that cost shift, the less costs that you wind up having. Now, as Katie just said, one of the challenges in year 1 is, you're a Colorado consumer and you're sitting out there and you're saying, so do I want to go to this market? Well, if you don't have any health problems, maybe you do and maybe you don't. Yeah, there is a mandate for insurance, but what's the real world market reality of that? If you're sitting there and you have health problems, you are going to come to the market. And that's a fundamental change, that on December 31st, 2013, if you are sitting there with health problems, you couldn't get insurance. On January 1st, you will be able to get insurance, and we got to find a way to roll that into a long-term.
So all of a sudden, the insurance companies are paying for a lot more things that they weren't paying for.
And so far, the penalty for not signing up appears to be smaller for a lot of people than the actual cost of the plans that they may have to choose from. So then it becomes, in part, a marketing, public relations, sort of public ethics campaign of, we all need to do this, otherwise it doesn't work. That's not cheap. And so part of the debate with the exchange has been, how much do we spend on this? The spending isn't free. It comes from federal dollars, which either have to come from the hundreds of billions of dollars in new taxes that came along with the Obamacare passage, or debt, which we have plenty of already. And there's been quite a bit of debate on the exchange of how much federal money to ask for in the next year or 2 of operations, because they have a lot of startup costs, a lot of IT costs, a lot of advertising costs. How do we create the navigators that explain the system. How do we advertise to people? There was a poll this week among Latino voters who were very much in favor of it, but only about 6% know what the exchange is and what it does. And so you have to reach that group of people, and that's a group that Elisabeth is certainly looking out for in terms of finding out. So there's a debate about whether the federal grant application should be $125 million in the next year of operations, or somewhat more, somewhat less. And Steve was on one side of that with some other people and talking about how reminding people this isn't free and we should spend it responsibly, and other people saying we need to spend as much as possible to bring in enough people to keep it going.
And before we go to the price tag, I know where you're going to go to that grant, but one of the things that Michael said is really, really important there of when you look at the amount of the penalty, and the Supreme Court has told us it is a penalty, and therefore it's a tax. And so therefore there are limits to how you can raise that. But how do you make this then work? How do you create a market decision? And one of the interesting things about this is, again, this is a matter of law. We can't just make up whatever rules we want as we roll this out. And yet the law as we are dealing with it is different from a very key other federal program, Medicare Part D. Now what's really interesting is Medicare drugs are guaranteed issue. You turn 65, you want a drug benefit, you get a drug benefit. And there's no mandate. And there is no fine, there is no tax if you choose not to. And yet the overwhelming majority of 65-year-olds choose it. Why do they choose it? They choose it because if they decide not to, and they subsequently want to buy it, it will cost more. It will cost significantly more. It will cost 1% more for every month they go without having it. And so 65-year-olds, and I'm not that far away from that, will take a look at that and say, I don't need pharmaceuticals right now, so why would I buy this coverage? And the answer is, well, because maybe I'm going to need them next year, or 3 years from now, or 5 years from now. That kind of market dynamic is the kind of conversation that we ought to be having about not do we repeal, do we replace, but how do we improve?
Well, and I'm going to suggest that most families understand the risks of not having health insurance coverage, but the difficulty for them has been that health insurance is extraordinarily expensive, and we've seen Milliman actually just came out, actuarial firm just came out yesterday, I think, and talked about how the average cost, out-of-pocket cost of for a family of health insurance now is more than their food budget, more than $9,000 a year. And so families want health insurance by and large, I think, and this provides them with an opportunity to get it now. And the subsidies are the mechanism by which families who aren't going to be able to afford it today will be able to afford it in the future. And I think that's the most significant part of this discussion, is it's providing an opportunity to do something responsible in terms of taking care of your family, not only their health, but your financial status as we move forward.
The cost question is very, very interesting, though. You know, at what cost? In the exchange meetings recently, you know, we've had these conversations about we're spending $200 million to set up a private health insurance system. I mean, essentially, this is still to allow people to get private health insurance. And Steve, you said something so interesting recently, that we have this wonderful history here in Colorado of bipartisanship on health issues and really trying to create Colorado solutions. And that we are a purple state. We're not on the extreme, but that you were worried that going for so much federal money, and there was a really kind of ugly meeting with lawmakers who felt a little blindsided by these huge dollars that we're now seeing. It's costing more, that this could undermine bipartisanship. Can you talk a little more about that?
Absolutely, and I do think that's something that needs to be addressed because, and I don't know that this was intentional, but just the way it fell out with the Legislative Implementation Review Committee meeting and the second to the last day of the legislative session. We all know, all of us sitting around here know what those last 3 days of the legislative session often are, and having a price tag that was a lot higher and not having had more robust conversation. The price tag is what the price tag is. The conversation at the exchange board, as you both know, all of you know, was in terms of, okay, but these dollars are going to be spent. Should we be able to access federal dollars to get whatever it is that we're looking at, or should we charge Coloradans fundamentally down the road? That's a worthwhile conversation to have, but it's a conversation you ought to have. and it should be broader than just the 9 voting members of the exchange board, and that was my main concern. I see arguments on both sides because, frankly, because of Colorado's model, which, as I noted at the outset, has not gotten enough attention. We are the only state that has health plans on the board of directors of the exchange. We are one of the only states that are building a robust marketplace, and I don't know that anybody has attracted the number of plans that we have. Now, we're going to find out whether a California model works better than a Colorado model, or whether a Colorado model works better than a Vermont model. That is the irony of many of the conservative criticisms about Obamacare, is it's this federal takeover. Actually, it is federalism. It is an experimentation state by state, and there is value in Colorado building this unique model on the ground here in a way that's going to work for Coloradans. But that does require a bipartisan discussion if it's going to be sustainable. That should have been one of the lessons we learned in the passage of the Affordable Care Act in a purely partisan way. That then creates these issues that are going on in Washington, where Republicans can say, hey, I didn't vote for it, I don't have anything to do with it, don't worry, don't bother me with the problems.
And they're still voting to repeal it, by the way. They're still, in some arguments, ignoring other business and voting to continue to repeal it.
Right, and so how can we sustain the bipartisan discussions that we've had? It's harder to do that way, and we saw it on both sides over the years, right? When Republicans control the governor's office, control the legislature, there is a tendency not to include Democrats, and vice versa. But health care is so important. It truly is a bipartisan or a nonpartisan policy discussion that we ought to be having. And I think that's one of the takeaways of the 208 Commission. Even had Elisabeth and I working together.
Can I say one more thing? Because Connect for Health Colorado, that's the name of the health benefit exchange. I just want to make sure we leave people with Connect for Health Colorado.
We'll leave it there. That is Colorado's State of Mind for this weekend. You may see this program again or any of our programs at video.rmpbs.org. Thank you tonight to Steve ErkenBrack and Elisabeth Arenales, and also to Michael Booth and Katie McCrimmon for help on understanding the new Colorado Health Exchange. Next week, let's catch up on another health-related issue. This one is also about big money, new laws and regulations, inevitable upsides and downsides depending on your point of view. What are we about to see as we become one of the 2 states in the nation on the verge of legalizing recreational marijuana? Hope you'll join us for that. Thanks for tuning in for this edition of Colorado State of Mind. I'm Cynthia Hessin. Good night.
Okay, how much choice is just overwhelming, and how much choice is things people want? Fact of the matter is, we have a lot of products out on the market right now, and every single one of them is there because somebody wants to buy it.